All right, good morning, everyone. I have 11:35, so let's go ahead and get started. We've got a decent little crowd going right now. Thank everybody for joining us today. We're going to have a nice little presentation. Shannon Smith from the American Heart Association is going to be here. I will be monitoring the chat. If you have any questions throughout the presentation, feel free to put them in the chat. If you want to ask them yourself, you go ahead and unmute yourself and ask them yourself. Shannon is very forthcoming with answers, so if you got any questions, feel free, please speak up and we will get them taken care of. Lana, are you on? Did you want to say anything today?
I am on. I just want to thank you, Shannon, for agreeing to be host the topic today for advocacy, such an important issue. Shannon is a member of our Kentucky Heart Disease and Stroke Prevention Task Force Steering Committee, and it's been several years. Gosh, I don't even remember how many years it's been now, but several years with us, and we just value her input and her participation so much. And I know you're going to have lots of good stuff to share today, so welcome and thank you.
Excellent. Thank you, Lana. All right. So as has been mentioned, our speaker today is Shannon Smith. She is the State Government Relations Director with the American Heart Association. Shannon, and she's also the Regional Government Relations Director in Ohio and Michigan for the American Heart Association. She has over 15 years of experience in lobbying. Shannon has spent her career navigating the legislative process at the federal, state, and local levels. Shannon is responsible for promoting the AHA legislation agenda across Kentucky while recruiting and coordinating with AHA volunteers. So everybody help me in giving a round of applause and welcoming Shannon to us. Shannon, the screen is yours.
Excellent. Thank you. And thank you for that warm introduction. I hope today to be able to share a little bit about advocacy and answer any questions that anyone has. I'm trying to find you all so I can see you. So give me just a minute here. Of course, never easy.
Well, we see your screen just fine.
You do? Okay.
Yep, it's perfect. And we can see you on our screen, so we're good.
Okay. Well, good. And everybody can hear me, so that's good. Yes, I appreciate being here today. I know that this is atypical of the kind of talks that we do or have, but I appreciate the opportunity to share advocacy and what that means. So I am a lobbyist, and I have to start with a funny story about lobbyists, because not everyone knows what a lobbyist is, right? Well, my stepfather was the government relations for the American Electric Power. He got a promotion. My sister was about 10 years old. And he had gotten a promotion, and he was telling my mom that he was a lobbyist, that he was going to be a lobbyist. He didn't know anything about it. Well, that night before bed, my sister says to my mom, "Mom, I thought Randy had a good job. I didn't know he cleaned lobbies." So it was, so from then on, I'm like, you know what, maybe I want to be a lobbyist. So just a funny story, because not everyone really knows what a lobbyist is, because we do hang out in lobbies all day, every day, just waiting to talk to lawmakers. So I will start with, and I'm going to start from just the basics, assuming that no one on this call is in the government relations world, that you don't follow politics, and that you do not know what lobbying is, advocacy is, or grassroots lobbying or direct lobbying. So forgive me if you do know, but we will walk through what it is, what I do, how to pass a bill, and then we will target specifically what AHA is doing at the local and the state level. And then we will talk about how volunteers can get involved and how you can be supportive of any of the causes or all of them. So the Kentucky State Legislature is broken up into the Senate and the House of Representatives. There's a total of 36 Senate members and 100 House members. Currently, all 100 seats in the House are up for re-election, and that is wrong. It's supposed to say 2022, so I apologize for the typo on the slide there. I just realized I put 2020. But as you can see, we have a supermajority Republican in both the House and the Senate. A supermajority means that even if the governor vetoes a bill or a law that has been passed or not, if he vetoes it, the legislature can come in and override that veto and pass that law anyway. The Kentucky is broken up into 120 counties, and here are all of the districts by House and Senate. There is a link there, who is my legislator, and if you follow that, you can put your address in, whether that's work or home, and find out all the way from local level up who your legislator is and who represents you. And then I just put in the breakdown of Kentucky by race and ethnicity. So what is advocacy? Advocacy is public support for a particular cause or policy. Anyone can advocate for a program, for their child, for themselves, for a law, for or against. You can advocate, that's really all it means, is that you support a specific cause or policy. And it is a deliberate process. What is lobbying? Lobbying truly means to seek influence of an elected official on an issue, any issue, but it is targeted towards an elected official. And that can be whether it's the governor, the president, your local board for school district or school board, you advocating or lobbying for them to change a policy at the local level. So whatever you're doing, if you are directly lobbying for a particular cause, it's to an elected official. There are two different types, direct lobbying and grassroots lobbying. Grassroots lobbying, which we'll get into a little bit later, but that's when it affects you. It's a personal cause to you that you are trying to instill change. It's something that's happening in your community, in your backyard, to your kids, to your friends. And you are advocating for that, not on behalf of another organization. Direct lobbying is on behalf of someone else or for someone else. So I'm going to spend some time here, but I will stop and take any questions. Please put in the chat box if you have it. And again, I am assuming that this audience is not aware of how we pass a bill in the state of Kentucky. So bill introduction, first you have to introduce a bill. You get a sponsor, you introduce that bill, or the sponsor introduces that bill. Then it is sent to a committee by leadership. So whichever chamber you go through, whether it's the House or the Senate, they send it to committee for consideration. It's funny, I don't know if you can see my cursor, but if you come here, it's introduced by either chamber, sent to committee, and interestingly enough, this is the most critical part of the entire bill passing process. If it makes it into committee and it is never heard, so the chair of the committee never calls it for to be heard or discussed in committee, it sits there to die. It's happened to me before. It happened this last legislative session on one of our tobacco issues, and it's the kiss of death for your bill. And you know it if it's sat there for a couple of weeks and you can't get it moving. It's incredibly frustrating. But if you can get it out of committee, means it gets heard and then it gets voted out of committee. It gets sent to one of the chamber's floor, whether it's the House floor or the Senate floor, where then they have to call it. So the floor leader, whoever that is in which chamber, has to call the bill for discussion on the floor. If that bill gets called, it's considered its first reading. The bill then gets sent back to rules, or if there's any changes to that bill, it gets sent back to committee, which is called recommitted to committee for any changes or amendments. If that happens, you have to start back over with the first reading. But if that doesn't happen, let's say you got through, then you go the next day or whenever the rules committee decides, the bill then goes for the second reading. After the second reading, goes back to rules, then whatever day it's decided to be voted on, it goes to the floor for a full vote and a discussion where all members have to vote and the majority passes it. That same process has to happen. So let's say it passes in the House, it is then sent to the Senate where the exact same process goes through. Vice versa. If it happens in the Senate, it has to go to the House. Once that happens, let's say you miraculously get your bill out of both chambers in short session, which is 30-day session, or a long session is 45. Let's say we get it out in 30 days. We send it to the governor. If he vetoes it, it goes back to the legislature for them to either pass or override his veto, or ignore or acknowledge the veto and let it die. If he does sign it, governor's signature goes to the Secretary of State, and it becomes law within whatever timeline they've set on it. It could be the beginning of the next fiscal year. If it has an emergency clause, it can be in effect immediately or in 30 days. So I spent a lot of time on that. Like I said, I'm assuming that no one knows how a bill is passed. It's very similar process in every state legislature, not exactly, but per our Constitution, this is how we pass a bill in Kentucky. So I will talk a little bit briefly. I'll touch on these, and I have some slides that I'll send this slide deck out following this talk for anyone that wants to look at these or examine the policies in more depth or have any questions following this. You can reach out to me. So local AHA priorities would include Lexington Complete Streets, Louisville Kids Meal Ordinance, in strengthening the tobacco retail license in Louisville. And this says Knott County Rural Smoke-Free Workplace Ordinance, and we were successful in passing that. So that is completed. We did get a comprehensive ordinance just passed in Knott County. And then we will continue, and this is the next two issues we will continue at the local level and at the state level, and that is health equity funding for a multitude of areas, as well as continuing to protect smoke-free workplace laws throughout our local communities. So the first one is Complete Streets, and the reason that the AHA gets involved in this space is because we need to have safe, equitable streets for all people in all modes of transportation, using any mode to get to their place of work, worship, play, fun, or home. So it's critical to ensure equity and safety in our streets. Louisville Kids Meal Ordinance, and I'm flying through these just because the meat of this, of what I think will interest you all, is our state priorities. Our Kids Meal Ordinance, we are looking to strengthen the beverage component to no added sugary beverages in any default beverage that's offered at a restaurant. That absolutely does not mean that parents can't choose to order their child whatever they want. Just on the menu, it's listed as a healthy option for a default beverage. So if you pull up to a restaurant, fast food place, you order a kid's meal, the default is milk, water, or juice. This slide I like to put up there just for reference to show, in Kentucky, we have had over 20 years, we've been able to pass comprehensive smoke-free workplace ordinances, yet we have less than a third of our state covered under smoke-free workplace ordinances. Our 2022 state priorities. So our first big push is repeal tobacco preemption. And just even saying that out loud, it's like that, what does that even mean? Well, it's local tobacco control. In 1996, Big Tobacco came into Kentucky. Actually, they went across the nation, passing laws that prohibited any community from enacting an ordinance that related to the sales, marketing, or distribution of tobacco. It really tied the hands of local communities to address what was happening, in their backyard. So the important part that why AHA is involved, why we want to repeal this, is we know the youth vaping epidemic has gotten out of control. We have a slogan, it's called Nix the Next, and we hope to repeal that old law so the communities have the tools that they need to limit marketing of these vape products within so many feet of a school or a church or a daycare facility, remove them from in front of the counters and force them to keep them behind the counters. Additionally, communities could vote to not sell vapor products in that city or county. So this would really give options back to local communities to help fight the vaping epidemic. And we know, the reason, the health consequences of smoking are I don't think I'm telling this group anything that you all don't know already. So I'm not going to go over the issues we have. But what I will say is we have seen that youth vaping has gone up even since COVID. It's continuing to go up. And we've passed laws in Kentucky that prohibit anyone under the age of 21 from purchasing these products, yet they are still getting their hands on them. They are still using. Our schools are still having a terrible time fighting this epidemic. Our next big push in Kentucky will be to restore the prevention and cessation funding. In 2020, our state legislature cut the prevention cessation funding from 3.6 million down to 2 million, and leaving us, in a desperate state of how do we fight? How do we offer cessation, especially, or therapies to children or adults that want to quit? The master settlement agreement that we receive in Kentucky, we have a portion of that funding. That's where our prevention cessation money comes from. Currently, our state revenue, we have a little over 500 million in tobacco revenue, and the CDC recommends, per our smoking rates and our health statistics, that we have 56.4 million in funding for prevention cessation. We have just a incredibly small fraction of that at 2 million, and we will be asking the state legislature to support an increase up to 10 million this coming session, which begins in January. Just an interesting number I put on here. The estimated annual tobacco company marketing in Kentucky is $274 million. They are outspending us drastically. These are just additional statistics on smoking rates, what we spend at the state level, what it costs per household, almost $1,000 per household, just in smoking related illnesses for each family. That is, it's mind-boggling to me that we can't even fund a little bit of prevention and cessation because of these numbers. Our third, this is a super busy slide, but I left it busy in case anyone wanted to go back and look at why and get into the specifics as to why we are at the AJ looking to establish nutrition, physical activity, and screen time standards for in-home childcare. We just passed in 2021, this past legislative session, we passed these standards, and we established these standards for out-of-home or licensed childcare facilities. And we know that, the trajectory of a child's life starts, from the day they're born. So it's incredibly important that they have a good start in life. Also, this ensures equity and quality childcare for all, which is important. Our next issue that also gets at the child's trajectory of life is we will work to extend the Medicaid postpartum coverage. And right now in Kentucky, Medicaid only covers 30 days postpartum for maternal health. Our proposal would extend that to 12 months, healthy mom, healthy baby. Most of maternal or pregnancy related deaths happen 7 to 41 days post delivery. And here's just some information on why it's important, why it's critical, and why the AJ is involved. Our next one, and this is where I will, lean on this group as well as ask for you all to get involved in helping me navigate where we go with our STEM equality systems of care work. So I know that most of you may or may not know that we have a stroke systems of care work here in Kentucky. We, however, do not have a heart attack systems of care with EMS protocol, transfer and transport protocols to identify where the hospitals are, the best treatment for patients, and how to ensure that they get the best care possible in the quickest amount of time. So we are walking carefully into establishing a STEM equality systems of care to designate the appropriate medical facilities to treat heart attacks, same as we do for stroke patients, and to ensure that care is delivered promptly in the right amount of time to improve patient outcomes. We currently have two potential sponsors that are looking to, let me see if I have, so we do have, this is an ask, this is an immediate ask. You can take action right now on this. This is a way you can get involved in being an advocate specific to this issue if you would like. Also, following this meeting, I will have additional alerts just like this that can go out if you would like to take action. But if you text STEMI to this number, it will send, we will be able to hold your message that tells legislators that you support establishing a quality systems of care for heart attack. We will hold these messages until our legislature goes into session, and then we will push them out to the lawmakers via email to show who and how people around the state are supporting this type of legislation. So this is one way that if you want, if government relations or advocacy isn't in your everyday work or what you focus on, you can get involved and you can help and you can take action. We draft the lawmakers' message to them, so you don't have to draft that by texting this. There is a already written, we support STEMI systems of care in Kentucky, please vote yes on the whatever the bill number is when we have one, which we don't have one yet. But again, a way that you could take action even right now on this type of issue. Any questions or conversation or opinions around STEMI? Okay. We will move on to our next one.
Shannon,
Yes.
I'm sorry. So on the last slide, if for those, I mean, would it, I'm assuming like the more people who text that, the better.
Absolutely.
So you having people in our labs and stuff and talking to them about this and having them do this would be beneficial. That is correct, right?
That is absolutely correct. And there, the thing is I can go up there all day and I can talk about how good a piece of legislation is or isn't, but the lawmakers like to hear from their constituents. It matters more than any organization or business or government relations director walking into their office and saying something. It's, the power and numbers of the people they represent or the state and all of leadership, the lawmakers that are in leadership, they want to hear from everyone in the state. But every lawmaker truly takes to heart what their constituent wants. So the more advocates, more volunteers that we can get involved in an issue to support, the more likely we are of being successful in having that legislation passed. And sometimes we ask volunteers to specifically target a committee, and that goes back to how is a bill passed? Because a lot of times if it is sitting in committee for several weeks and we engage with our volunteers that have taken action, or we see that they've reached out, they've taken action on an alert maybe, or they're part of our You're the Cure network, which I'll get to a little bit later in the presentation as to how you can join the You're the Cure. But we know that we can reach out to those individuals and say, will you call again? Will you ask again? Will you help us reach these lawmakers? And it's the only way we're successful. I've never been able to pass a single bill without support from the people that law matters to. So this one matters, I think, across the board to everyone. And I love this slide so much. And I'm not sure most people have seen it, but I'm going to talk just for a second about a video that I love that drives me every day in the work that I do. And it's a coach that lines all of his students up on the line, and he starts asking questions. If you're white, take a step forward. If you have brown hair, take a step forward. If your parents are together, take a step forward. And then he also asks some really challenging questions. If your parents aren't together, take a step back. And then he tells them, okay, now go. And there are people that are standing on the finish line, and there are people that are behind the starting line. So the difference, that just goes to talk about the difference in equality versus equity. And in 2021, there was a commission on race, equity, and access to opportunity established. However, it wasn't funded. So I will be working closely with the sponsor of this legislation, who now sits as the chair of the commission, to fund this commission and hopefully reach out to those of you in the community that see it every day and can identify places that we need to address the access and opportunity piece and equity, because we don't know. And this commission doesn't have a set agenda. It also doesn't have a set budget. So I need to hear from individuals, and our lawmakers need to hear from individuals as to what do we need, how much money do we need in this, and what do we need to do with it? What are best practices as it relates to where we can make a difference, large or small? So this is an ever evolving initiative or goal for advocacy, and this will be on my agenda for years to come. I will continue to work. And when I say my agenda, it's really the AHA's agenda. I'm the one out there in front asking for volunteers to help me and talking to lawmakers, asking for their votes too. So if there are no questions around, I feel like I'm talking about our policies a lot. I want to make sure that I'm also identifying ways and why it's important to have volunteers engage, and how you can be engaged. And I shared all of those policies mainly to show that there are lots of ways that AHA is impacting our community and our state. And there may be many different issues that are completely different, whether it's a complete streets policy about transportation and roads, or a STEMI system of care, and you don't have to be involved in all of them to be involved in one. If you're passionate about an area and you have expertise in that area, or you just feel like your heart moves you to want to take action, or a lawmaker and you think, I know a lawmaker, I want to get involved, I want to help pass. And it doesn't have to be AHA's agenda. It could be any agenda or any law that you want to support, contacting that organization and how you can, and how it doesn't have to be, you don't have to do it by yourself. If there's an issue that you're passionate about, you can find someone that's probably supporting it, and you can ask for information, you can ask to join their mailing lists. I think that is a place that maybe a lot of times people that want to engage in an issue at the state level, it feels overwhelming because they don't know where to start. And it's not that it's easy, but there are avenues that you can reach out to people like me. Anyone on this call can reach out to me if there's an issue you want to know about, and I can either help you with that or guide you to who could help you with whatever you are passionate about. So I'll stop for just a brief second and see if anybody has any questions or would like for me to elaborate in an area on specifics. Okay, so some of our
I have a question, Shannon, and you don't have to answer this, and you may not have the answer for this, but when you mentioned the tobacco local control, with all of the fighting about the local control over mask mandates and everything we are in the pandemic, how has the tobacco managed to be, a silent issue? I don't know how many people here have heard about it, but I never hear anything about it. So how is that even possible?
So, unfortunately, and this is a little bit of the kind of the dirty details of the tobacco industry that, and politics also, but the reason that our bill died in committee was the tobacco industry spent quite a bit of money on campaign contributions to our House leadership, where they were told there's an election coming up, and if you let this be heard in committee, we will pull our campaign contribution. So that's the down and dirty as to how and why Big Tobacco has control over Kentucky. as a tobacco state is the money they spend on campaign contributions and marketing in the state. And not just Kentucky, but we are heavily marketed in just because we are a tobacco state. So unfortunately, we had so much support from the pretty much name a local organization. They had signed on in support of this local control, from the county judges to the magistrates to mayors, superintendents, school boards, PTAs, ad districts, health departments. I mean, you name it. And we still couldn't get it moved because Big Tobacco told leadership not to move it. So we are up against that. And I'll tell you, just speaking of strategy and why and how things happen, our strategy for this session is, so again, power in numbers, right? That doesn't just apply to volunteers, but also to their own caucus. So our strategy is to gain as many co-sponsors as we can of this legislation, because when you have 5 to 20 legislators every caucus meeting asking for this to be heard, it's a lot harder to give a reason as to why they're not going to call it instead of just brushing it under the rug. So if we have 20 sponsors, or I think we're going to run it through the Senate, and our goal is to have 9 sponsors. You have 9 sponsors of the, so there's 7 Democrats and 3 open seats. So let's say that, of the 15 to 18, you've got 9 of them saying, we want this to be heard in committee. It gets out. It gets out that it's an important issue to caucus, and people start talking about it. So there's power in numbers also there. So our new strategy is we are targeting the messaging around youth and gaining as many co-sponsors as we can, which would force caucus to move it out of committee. And the only way we are getting those sponsors to sign on through our grassroots. It's the people at the local level calling their lawmaker and saying, we want you to sponsor this legislation. We want the ability to remove these products from shelves. We want to give communities the way to fight what's happening to our youth. We don't agree with big tobacco. So, and anyone that is interested in engaging, we write the messaging. It's very clear. You call the number that we put on there. You call, you read the script. It takes 3 minutes. They record the message. They give it to the lawmaker. So it's easy to take action. And then we have the simple ones like the text to join alerts, where you text the number and it sends it directly to them. So easy ways for us to gain volunteers. And right now in this specific campaign, our ask is of more and more sponsors. If you have a good relationship, or even if you don't have a good relationship with your senator, they are your senator and you're their constituent, they have to listen to you. They work for you. That's the nice thing about this. I always tell volunteers, especially lobby day, when we have, we used to get to have lots of people come to the Capitol, they work for you. You go in there, you tell them what you want, what you need, what you see in your community, because you elected them, and they can't hold this office unless you elect them again. So they want your vote. So always remember that they work for you and they need your vote, and tell them, I'm not going to give you my vote, or I am. And that is self-advocating. That's also grassroots lobbying, which you don't have to register for if you're doing grassroots. That was a long explanation for that question.
But it was a good one. Thank you. Appreciate it. I didn't mean to derail you or anything.
No,
so
not at all.
Go on.
Not
Thanks.
at all. You're welcome. And we could go over these if you wanted. Obviously, these will continue to be AHA national priorities. Funding for research, surprise medical billing, and finding a resolution for that. I don't think there's a clear-cut answer yet for surprise medical billing, but we are on the side of the patient, and AHA advocates on the side of the patient and not the hospital in this case. Improving access to care, whether that is through expanded Medicaid or establishing telehealth services, whatever those issues that come up, we try to be nimble and reactive quickly as to how to support improving access to care. It's pretty much an issue about every state, the funding for prevention and cessation. Some of us, like Kentucky, have bigger issues with it than others, but it's a push all the way around. And then just recently, within the last couple of weeks, there has been a bill filed to increase the national cigarette tax by $1. So we shall see. That vote could happen as early as next week, and it's going to go, I believe it's before the Ways and Means Committee. And again, you can do the exact same thing. There's a number you can call and tell your congressman or your senator, I support this or I don't. And it's they ask you for your address so they know that you're a constituent, because that's the most important thing to them. What do my constituents think? What do they want? I put a list. This is not an exhaustive list, but this is some of the bigger wins that we've had in advocacy. And I'd like to go back and say, not one of these could have happened without the support of volunteers. And I also said that you could be an expert. You don't have to be an expert on an issue to feel passionately about it or to want to engage. So it's nice to be able to have, so we had a proposed cigar bar exemption in Louisville a few weeks ago. And we had a pulmonologist testify, which was wonderful to have them, lend their expertise. And then we had the most amazing youth advocates that just talked about what it meant to them and how important it was to them to have a comprehensive smoke-free workplace. And I think that the youth volunteers spoke more to the council than even the pulmonologist, who is the expert. So just because you don't know anything about an issue, or you know very little, or you know all about it, you can engage either way. But one of the third bullet down that I'm the most proud of is Kentucky was the first in the nation during the pandemic to establish telehealth standards that included cardiac rehabilitation codes. The first in the nation. That is incredible. And our Medicaid commissioner really got out front on that, and our lawmakers supported it. So having those cardiac codes included, it was critical. We've had a couple of states follow suit since, but I will tell you, in other areas around the nation, they aren't including that intensive cardiac rehab, which is critical to care and to recovery. So I have worked with partners across the nation to help get those codes included with their Medicaid also. So what else? Grassroots, I've talked about it. I put the definition of what it is up here. This is a slide from the last time we were able to all be in person in DC, and it's called AJ Day on the Hill. And we ask our volunteers that want to come join us. Constituents from all over the country come, and we sit down in congressional and Senate offices and talk about our national priorities and then some of our state priorities also. If we're in there and it's our congressman, we let them know what we're doing in the state and ask for them to be supportive with the state lawmakers as well. So, this is an overall nationwide goal that we had, and AHA, of our priorities, we were successful in passing 163 policies last year. I thought that was a pretty big number to be able to, the tangibility of the amount of work that goes into and passing these policies and how we are moving the needle on public health, maybe small ways and maybe large ways, depending on where those policies fall. But every single one of them matter to continuing better health for all people. So again, the You're the Cure, I'll stop here and talk about our You're the Cure network. We have, the AHA has a database of You're the Cure advocates that you put your email and your phone number in there, and we can send you updates on what we're doing at the state level, at the national level. You can choose the issues that you want to be engaged in. And I thought I have my, this right now, this is Kentucky by numbers in our You're the Cure network. And what's a little off is if you see the statewide numbers, we only have, of all the numbers we have in our network, only 2,000 of our You're the Cure advocates are emailable. Sometimes, people's email change, they change jobs, and so they don't update their information in You're the Cure. And then we can't get you information. And then when you're like, well, I wanted to engage in that. Well, we couldn't email you because we didn't have the right email. So if you do join, which I hope everyone on this call will join our You're the Cure network, and I'll have that text up here in just a minute. It's a text to join also, but you can decide whether you want to be emailable or textable. And if we text you, you can just send the message straight from your phone. You hit the link and it goes straight from your phone to the other texting. So we tried to make it streamline it a little bit, make it easier. That way more people can engage as they would like. And then I just put up some of the other big counties and their numbers. Volunteer engagement. If you're not comfortable having a face-to-face meeting with a lawmaker, there are plenty other ways to get involved on issues, letters to the editor, participate in advocacy trainings, which is what this is, to learn how to get involved on an issue. You can do written testimony, so you don't have to show up in person, phone calls, text messages, and then cards, petitions, town hall meetings, which we're not really having in person right now like we were, and then participating in our lobby day. This year, our lobby day, we were hoping to, I was really hoping to have the date nailed down by the time this meeting rolled around, but due to COVID, they are not setting in stone some dates through the Capitol yet. So it will either be the first or the second week of February, and everybody will get an invite to attend. It will be virtual, and you can pop in and out. I'll send out an agenda with it, and we'll have different lawmakers that come and speak on different issues. We're hoping to have the Medicaid commissioner come and talk about the things that she's doing and improved access to care, as well as other partner organizations. And we'll have lots of youth, which is always my favorite part of lobby day. I talked about that. These are some of our target districts for growth. This is where we lack really a large number of volunteer support. The first 5 names of each list, the Senate and the House, are our key target areas of growth for our You're the Cure network and advocates. And those would be leadership, the 5 Republican leadership members in the Senate and the House. And just to go back to politics a little bit, even though there are 138 members of the legislature, these 10 individuals control everything that happens. And it's scary to a degree, because there isn't always that balance of power there when 10 people can control what happens, what bills get presented, what bills don't. So it's critical to have constituents in those 10 member districts that can reach out to them and identify what's important. This is a way you can join at the federal level. Again, it's text in game. This is our federal push to end tobacco and to really help the vaping epidemic and keep these products out of the hands of youth. And you can learn more about it too. I believe as soon as you sign up, you can, I didn't text this one. I just had this one sent to me last night, so I included it last minute, but this is one of our most popular campaigns going right now. And I will tell you, we had a youth from, I was reading that quote, we had a youth from, it was Wisconsin, and she put into words what's happening with the vaping epidemic better than I have heard since this started. And I'm going to butcher it a little bit, but she said, I wish I could talk to my 12-year-old self and tell them what has happened to my pocketbook and my health. And it was so powerful. And her entire testimony went on to just, I'm like, if I'd have heard her, even if I wasn't involved with AHA, I would want to get involved with that campaign. she spoke from the heart, and she's, you know, now I have this addiction. If I would have never picked, if I could tell my 12-year-old self that is not candy, then I wouldn't be where I am today. And so it was pretty powerful stuff. And then this is the Become an Advocate Today. Text Kentucky to this number, and you get to join me in all of my initiatives. And I would just encourage each of you to, and ask you to, because the more of the experts and the people that are passionate about it, the better chance we have of success on these policies. So that is the end of my presentation. I touched on advocacy, I touched on lobbying, I touched on how things become law, and then I spent most of the time talking about what we're doing at AJ and advocacy. I hope I was able to explain what we are doing at the AHA, but also what advocacy and lobbying is. There's no stupid question when it comes to lobbying or advocacy. This is my world that I live in, and lots of people on this call, I have asked so many clinical questions over and over and over, and they're like, we've said this 15 times. I'm like, I know, but it's not my world, so I don't understand. So believe me, you can ask me anything. I know that it's not your world. So, and you may not have, maybe I just did a great job and there are no questions.
Well, Shannon, I think you did a great job. So while people are thinking up their great questions to ask you, I will connect with you after this if you will share the PowerPoint with me and all of the information on these text numbers. I can get them posted to our website. I did notice that you had a few PDFs, it looked like. If you share with me links to those or the actual PDFs, I can share them on our website. And I will post the video and all of the documents and resources that you're sharing. And then sometime, probably next week, I will send out a follow-up email with direct links to the website where they can get all of this stuff. So thank you so much.
Perfect. And I'll send out, I'll inundate you with information that you can then send out. But thank you for letting me, have this time. And I would encourage anyone that's on here that would like to join my committee on the steering committee, or my piece of advocacy, to learn more, to engage. I also would love to learn more from each of you. So if you're looking for a committee to join, I would love to have you join advocacy.
I wanted to echo what David said. You did do a great job. And it's funny that you invited them to join your committee, because I was getting ready to do that as well. The task force group is open to anyone who would like to participate. You don't have to be clinical. We have a spot for you. If it's not advocacy, it could be heart systems of care, or our stroke systems of care. I know that we have Megan Schweitzer on the call today listening in as well, and she's the chair for the heart systems of care, and they're looking for folks as well. And just because you're on one committee doesn't mean that you can't chime in on another committee as well. We have some crossover that happens. And Megan, you want to pop on and say hello? Maybe. I don't know, she might have gotten called away for a second. Well, anyway, we do have that, and we also have CASH, which is our public health group, and we would love to have you in that. Gina Bryan is also on the call, and she's the chair of that committee. But if anyone would like to join us at all, just let us know. Send an email either to David or even Shannon or me, or there's a lot of folks on here that you can contact, and we'll get you in touch with the right person. So thank you, Shannon. That was great information. I didn't know how a bill went through. I only remember the what was it? It was that little "I'm only a bill." It was a cartoon. David knows what I'm
Schoolhouse
talking about.
Rock. Schoolhouse
Thank
Rock.
you.
Yep.
Thank you. Schoolhouse Rock.
You're just a bill on Capitol Hill.
On Capitol Hill.
Does anyone else have any questions for Shannon? All right, I'm getting lots of favorable comments. Everybody in the chat saying thank you, great information, great job. So I guess we have no questions. Lana, while I have you, do you want to say anything about, I don't have any information. Our next task talk is going to be sometime in November. They'll get a little bit more. It's going to be Cloverdale, but I honestly don't know anything about Cloverdale. Did you want to mention anything about that, Lana? And more information will follow. So
Sure, it's in the beginning stages. It's actually Coverdale, and
sorry.
no, that's okay. That is a grant that a group of us are working on with UK, and it is got a lot of implication for stroke systems of care. So I don't want to let the cat out of the bag at this point. I'm not exactly sure what all they're going to talk about, but I think they're going to give some updates on that. Oh. I see you, Megan. Couldn't find the microphone. Well, anyway, it's been great having you, Shannon, and for everyone else, we will give you more information on upcoming task talks. We appreciate everybody joining in and hope you learned something great today.
Thank you all very much.
All right, thanks everyone. You guys have a great afternoon. Try to stay dry, and hopefully we'll see you again in November. Bye.
Thank you.